Your Medicare Advantage plan could be changing soon. So, this video is just a heads up. So, if you have a Medicare Advantage plan going into 2025, or you're about to turn 65 this year thinking about Medicare Advantage, there's a couple things you might want to consider. Let's get into it. Okay, so if you're new here, in the description below, there's a link that is a registration form to the free Medicare 101 webinar that I run every week. It's very informational. It's a literal 101 webinar, so it's going to teach you the basics, who, what, when, where, how of Medicare. There's also a book that I've co-authored. At the very bottom, if you're one of those like my mom who says, Alyssa, mija, I like the paper copy. She likes to feel it. She likes the page turning of it. She likes to highlight and mark. That's also in the description below. So let's talk about the Medicare Advantage plans that are to change. Which ones are going to change? All of them. The answer is all Medicare Advantage plans are going to change this upcoming year in 2025. So here's why: is the margins are too small for the companies. Whether you chalk this up to inflation, you chalk it up to whatever issue is, whatever news outlet you watch, it's fine. So I'm just telling you what's going on in the Medicare world, which is there's too much spending going on. There's too many claims. And then obviously the company's having to pay that out. And so there's going to be changes of benefit changes. So pullbacks of benefits. As I already said in previous videos, in 2025, we can already count on the cap of the amount of copay that you pay for your prescription medication is going to cap at $2,000. So kind of a prediction rolling around in our world is, well, somebody's got to pay for it for the rest. Somebody's got to pay for the high costing medications that people are coming out of pocket already. So plan premiums could be on the rise in 2025. But already let's push the speculation aside and let's look at what's already happening. So CVS is kind of in the news right now. I've pulled up a couple of articles and they pretty much say the same thing. And I'm going to share my screen with you now. Right here, this article says Medicare Advantage extras are on the chopping block in 2025. So basically the CEO of Aetna said CVS has divested, because CVS and Aetna, they're same. I don't know who's the parent company of who, but same people. So CVS Health has told its investors that Medicare Advantage costs keep climbing, partly driven by the seasonal inpatient admission. So being the overnight stays at a hospital, outpatient services, as well, and dental spending also increased costs. So my boomers out there, you guys you're looking to get your teeth done because now things are happening, right? So you're looking for plans with a lot of dental, and some people choose Medicare Advantage based on these benefits. So let me press pause, because I am not I'm not a proponent of you looking at a plan for its benefits, because let's come back down to earth and remember what we're doing here. We're talking about your medical benefits. So part A being hospital, part B being medical, anything you go in and out of, doctor treatment. So in the conversation you're having with your agent, and what I converse with every day with my clients is, what's your health like now? What are you prepared for in the future? And yeah, if dental costs are going to be your biggest out-of-pocket cost this upcoming year, then yes, we may plan around that, but we'll plan sensibly. In other words, I don't want you to join a plan based on benefits, based on, Well, my plan gives me a spending card. My plan gives me, uh, I can't tell you how many calls I get from my clients saying, do I qualify for this $3,000 spending card that they keep advertising? No, no. And I'm not saying no, they don't most the people who do qualify for that, I've already spoke to, and they're probably already on that plan. But for everyone else, if it sounds too good to be true, it more than likely is. Okay, so let's just say a plan gives you 5,000 in dental, but what are you sacrificing? Remember, in the world of Medicare Advantage, we're talking about give and take here. So, what are you taking, but what are you giving up is the question. So just remember that, there's like 60 some odd plans per county. Eh, Three-fourths of them are garbage. And some of them do the exact same thing. And some of them are very tailored to like, for example, chronic conditions. They're tailored to people who are needing, or frequent flyers needing good to go see the doctor every 3 months. So just be very wary. And even those give back plans. Yes, I have new clients on give back plans, but I literally have them on a recorded call. Okay. Because all agents are supposed to record their calls. Um, I literally have them on a recorded call saying, yes, Alyssa, I know that my plan is going to give me $100 a month. And I understand that I'm sacrificing copay premiums. You're not sacrificing medical care if you take these benefits. That's not what I'm saying. I'm saying you're sacrificing your out of pocket dollars when you do need to use those medical services. So as long as you're aware of it, right? This channel is always meant to bring about conversation and just to look at it five different ways. I always tell my clients this. Hey, my job is to poke holes in whatever you plan you settle on. And if you can defend your plan in front of your pickleball circle, in front of your friends at the Y, if you can defend it at the coffee shop, you can look at a commercial, you can look at the garbage that they mail you and say, not for me, because I know my plan. That's my goal. Okay, I'm off my soapbox. Back to the article. Okay. So this is what I was reading. The company led to the industry notice outlier. Okay, some Aetna plans, and this is just so Aetna is just breaking the ice. It's not just Aetna that's being affected. It's all companies. Monkey see, monkey do in Medicare Advantage. So it says some Aetna plans offer a fitness reimbursement. According to the Wall Street Journal, members could cash in their benefit for pickleball paddles, golf clubs, and other sports equipment. But these extras could be a thing of the past in a tougher rate environment. So that's one article. The other article, let's bring that up, looks very similar. So this is from Newsweek. Medicare Advantage plans are about to change. Less fear mongering than the other one. But um the media. Okay. So the goal next year is margin over membership. CFO Thomas Cowie said, could we lose up to 10% of our existing Medicare members? It's entirely possible. And that's okay because we need to get this business back on track. I think what he's saying is we need to get back on track. And what are we talking about? We need to get our focus back on health is probably what he's saying. Like I said, this isn't a CVS thing. It's not an Aetna thing. It's an all privatized plan, which are the Medicare Advantage plans. Those are going to get a shakeup. And so what is also going to happen, not only are they going to draw back their benefits or tone down or completely take out, who knows? Once upon a time, Medicare Advantage plans used to cover implants. They don't, there's hardly one, uh, I should say there's fewer now in the market that do. So, and that's because implants are darn expensive. So it's the same thing with all these other benefits. They're going to start toning it down, drawing it back, and reining in the reason why these companies exist, which is for health. So what we're also going to see is these companies coming out of complete markets. So that means counties, multiple counties, you may get a notice, and this is for everybody that's on a Medicare Advantage plan and a drug plan. So this affects you med sup people as well because you have a drug plan. So every year you're going to get an annual notice of change. Don't throw it away. You actually need to, this year more than ever, need to read your annual notice of change because that's what's going to tell you what changes in 2025. And that's how you're going to know if you're still on the right plan or if you need to change. And that's also how you're going to know if the company is no longer in your market anymore. They're going to say, sorry, you're going to need to pick a new plan because this plan will no longer exist January 1, 2025. So that is what this video is mainly about, is just to keep an eye out, keep your ear to the ground, be aware of what's coming out October, November, December of this year. And of course, I'm going to continue to make videos about this because I want you guys to again, from an educational uh, viewpoint, learn what's going on and not just read what's coming in the mail or at a seminar or on the phone from some call center. I want you to do your own research so that when these changes do come about, you're able to read through the BS and read the black and white and pick the best plan for yourself. Of course, there's agents out there like myself, but you guys have to be proactive in your own healthcare, and I think you know that. So, next video, who knows what I'm going to get into, but I'll be seeing you there. If you got anything out of this video, please like, comment, and subscribe. See you in the next video.